5, and at a typical preschool, they play soccer a lot, and he gets lost and zones at cause because he doesn't because he doesn't understand the basics of the game. We tried to put him in soccer shots, but it was too hard to keep up for him. It was outside, and he got distracted and frustrated and started crying. I was in another building, so I saw all this unfold. How can I help him with this? And they said, thank you in advance.
You know, it's a tough one because soccer is actually a pretty complicated, there's a lot going on. Group games in general, any kind of group athletics has a lot going on. I mean, it's not like there are basics. We could talk about what we would consider to be basics of the game, but the truth is the concepts are pretty advanced. I guarantee you that all the other children who are preschool age are also not really understanding the concept. The concept here is, you have to know how to be part of a group, how to interact with other people who are on your team. So that means you have to identify all the other people who are on your team. You have to know all the basic moves of soccer, like you have to run and shoot the ball and then be able to pass it to your teammates. And then you always have to keep in mind that you have the objective of actually reaching the goal and shooting the ball into the goal. So that is a pretty advanced thing. It's much different than, let's say, marathon running or even any kind of solo sport where you're just focused on the actual sub-behaviors of the task, the sport itself, rather than the team aspect. The team aspect makes it very hard. When you look at kids who are playing soccer, just typically developing preschool-aged kids, I mean, I think preschool is a really early age for soccer, but when you look at it, they're often running the wrong direction. They often will pass it to the wrong person on the other team. They will often even shoot in their own goal. And in my mind, I try to, and I did this with my kids, I always tried to not put them in a position where they might fail because it'll be a traumatic thing for them. They'll remember it. So I don't. If you really want, if everybody else is playing soccer and your child has no option but to be involved in that, then I would really perhaps try to initiate just teach him how to kick a ball back and forth with one other child. And then, the next thing I would teach is just the color of the jersey or somehow knowing the other children and who he should just kick back and forth with. I mean, once you know how to kick and run, that's probably, you're going to be better at soccer than others. Having said that, I heard that you have Vince Redmond on later today.
Yes, we do.
And Vince, in addition to being a LMF, licensed marriage family counselor, and have great experience and expertise in ABA. He's been doing ABA with me for over 20 years.
And is featured on the film Recovered.
Is featured on the film Recovered, and he's a fabulous supervisor. But in addition to all of that, he's also a soccer coach. And he is a crazy soccer player, and I would say soccer is one of the biggest parts of his life. So why don't you pose this to him as well, because he might have some better ideas in terms of how to break down the sport and teach the very basic elements.
And thank you. I don't think I knew that about Vince. Mm-hmm. So I think I knew that his daughters played, but I didn't realize that it was such a big deal to him.
Oh, it's him. So it's because of him.
All right.
Even when his daughters were born, I was like, well, we're going to have some girl soccer players.
All right. Okay, so now I know that. And thank you also for talking to us, because I think we forget sometimes how many different aspects of anything, whether it's soccer or being at a birthday party, how many different aspects of it that we're expecting a child to be good at all at once, and especially for our kids, it's an unrealistic expectation.
That's right.
But if we focus on one thing, I can remember going to a birthday party and being told to work on one thing. And then what happens for us as parents, when we leave, we know what one thing we were working on, and we can feel like, hey, we made progress on that.
That's right.
And you feel excited about it. So soccer's a lot of things.
So it is, just like any other, if you look at group sports, they're just really complicated.
Yeah. Okay, well, good advice. And we will talk to Vince about that in the next hour. I'm going to move on to the next question that I also promised we would get to last week. Hi, ladies. Thank you for imparting your wisdom. We're having sleep issues. I'm giving my son 1 milligram at night of melatonin, but he wakes up still and is very restless at night. We're trying to get him to sleep in his own bed, but when he comes to our bed, we're so tired we let him in. Oh, sister. can we talk? I am related to you. I get tired and I'd be like, burn the house down. I don't care, I'm tired. And then you continue to say, I have tried to put in an air mattress in his room, but then he just wants to sleep in the air mattress with me.
Right.
Any tips?
Yes, a lot of tips.
Okay.
I think the next one is also the same child, 5-year-old?
Yes, and she went on to write that the child is 5.
5. So your child is 5, and I'm not sure how much he weighs, but I'd assume, my assumption would be that you can, first of all, increase the melatonin. The dosage for melatonin, 1 milligram, seems pretty low. I don't know how much he weighs, but I would recommend that you consider, I personally found that melatonin alone for my children and for myself would have this weird effect of kind of like making us restless and just making us drowsy, but then up and down, and it didn't really work. But then I started to use this product that is called Tranquil Sleep, and it's melatonin and theanine and tryptophan, 5-HTP, all mixed together. And so they're all pretty harmless things if you take them in the right dose, and that is really effective, and it has a completely different effect. The dosage is very important, and I would imagine that your child, it depends on the weight, and you have to really, first of all, look on the box that you buy, but perhaps you want to order the Tranquil Sleep and try that, and perhaps according to the directions it might be appropriate for you to try a little bit of a higher dose. That will help. The behavioral aspect of this is, okay, so put an air mattress in his room and sleep there, and let him start with sleeping with you in the air mattress. That's your baseline. That's where you start. And then what you do from there, and I know it's so difficult because this is one of the most difficult things. It's exhausting. But what you will do is you will gradually, this is what I would do. You have the air mattress and you have his bed, and you attempt to try to get him to stay in his bed while you sleep in the air mattress. If that doesn't work, you should put the air mattress really, as close as possible to his bed, so they're like touching. And then you can sleep on the air mattress and he can sleep in his bed. You can even have your hand on him if that helps, so that he knows that there's contact. That's your step 2. So step 1, he's in the mattress, he's on the air mattress with you. Step 2 is he's in his bed, but you're touching. Step 3 is, 2 inches away. You move the air mattress 2 inches away. Step 4 is 5 inches away. And this is a gradual process, and you have to go back and forth. Like he might react, the moment that you move your air mattress in far enough away from him that he then again attempts to get up and come join you, is where you take him back, push your air mattress back to where it was the previous night, and go back to that. So it might take a whole month that you are on the air mattress and he's in his bed. But by this point, you will have very gradually over the course of this month moved the mattress closer and closer to the door. And believe it or not, you're going to have to just now go outside the door and try to move back into your room. And that's your goal. The easiest way to do that, obviously, is to just go from his room to your room, but you will have him, the minute you're not in his room, he will begin to come seek you out. You cannot allow him to come and stay in your bed anymore. That phase has passed. You have to understand that if you allow that, then you're back at phase 1, and you'll have to go through the whole thing all over again. Now, usually, there are other things you can do that might help. For instance, our children feel safer when they have perhaps some light on in the room. Not a lot of light, because too much light will actually not let the child sleep. A tiny bit of light. Maybe a blanket that has your scent. Maybe a stuffed animal. Maybe you can pad all around him in bed so that he's actually feeling more safe. Don't give him liquids late at night so that he wakes up because he has to go to the bathroom. Make sure he doesn't get to eat or drink anything when he wakes up, because when we wake up and eat or drink anything, we form the habit of waking up. That's why it was kind of important to look at the melatonin as well, because if he can remain asleep for a period of time, that'll be very helpful to you. Finally, background white noise often helps people stay asleep. White noise is like having an air filter in the room or something that just makes, because we never know with our kids and their acute sense of hearing, they might be waking up due to something else. So, this happens to all of us. This is very, very typical, and children can continue to sleep in the parent's bed for as long as the parent allows it. Don't think that you're doing anything traumatic by not allowing him to actually come to your room, because the worst thing that worst case scenario, the air mattress can stay in his room by the door, and if he comes to you, you walk him back, he sleeps in his bed, and you sleep on the air mattress. At least he's not coming to your room. And then you gradually keep trying to exit his room, and that's how you do it. It's a shaping procedure, and you gradually have to work on it. It takes time.
I have this theory that our kids, even our kids, understand the difference between, we can say no, and we can say it in the exact same inflection, but it's almost like they can read our minds. They know when we, like, if our kids are going to put their hands on the stove and we say no, even our kids, I see them react to how we say no.
Absolutely.
And I know with my kid, if I say no to something, and in my head, I'm 100% clear that it's a no and it's not conditional, he hears that. He sees that in my body language, and he hears that. When I say no, and there's a part of me that's not 100% sure, I am like a highway, and he's going to ride all over me, right?
Yes, of course.
And I think that that helps me always to remember that I say, oh, I'm ready for him to stop doing whatever.
Right.
I want to do that. But the truth is sometimes I'm not all the way ready, because I'm not ready to do all the things that I have to do to get there.
Right.
And I think that it's really important that we as parents look at that before we do anything. Are you ready? Because Dr. Granpeesheh just gave you the master class on how you can do this when you're ready.
Right. And this is very important what you're saying, Shannon, because if you're not ready, you're going to be all wishy-washy about it and go back and forth, and it's going to confuse the child and give him the wrong message, and it's going to drag this out into a nightmare. So it will, do not expect this to go as smoothly as I just explained, because I didn't mention that, hey, your child may react and may have a tantrum, may cry, may be upset that you're not allowing them in your bed anymore. But that's okay, because you do not want him sleeping there when he's 18.
Right.
It's just that simple. So really, and you're not doing anything traumatic. He has a very comfortable bed. It's a habit. You're trying to break a habit. And so you're trying to replace what do you provide that his own bed doesn't provide? Is probably a sense of safety and security and nurturing, and how you felt as a baby. So you're trying to give all of that to him as well, but he has to remain in his own room. And that's certain rules are just rules. It's like we teach our children to use utensils. Otherwise, hey, why can't they just use their hands? So certain rules are there because they are the social norm. It's not okay for a child to be sleeping with parents when they're a teenager, obviously. And so the sooner you work on this, the better. And it is, as Shannon said, it's harder often on us. This was a big thing for me. I remember with my third child, I had a very hard time with her with various issues, and this was one of them. But it's tough. It's a really and you are wiped out. You're so tired that you say, oh, forget it. It's not even worth it.
Honestly.
Yeah. But I mean, if you do it and you're pretty strict about it, and you do it like on a shaping schedule, as I mentioned, it really will be over in the course of a month, rather than going on forever.
And then you get the rest of your lives back. And, we've had Uncle Milton toys on the show before. I love Uncle Milton toys. They make a whole line of toys that will give you just a little bit of light. I love the moon in my room because it has the phases, so you can change how much light.
That,
but they have a whole line of toys that, wall hangings that will light up. Some of them even provide low sounds, soothing sounds
Right,
as well.
right.
You know, go with your child, look on their website, unclemiltontoys.com, and pick one out that they find reinforcing, that they'll want to stay in the room, to
That's
be in
right.
the room with
That's
the thing.
right.
Really, really
Absolutely.
helpful. We have the moon in my room still to this day.
Dude, I love
And
it.
it's
My
beautiful.
kids had it. Oh, it's very pretty. It's a very decorative piece,
Yeah.
and it's really nice. Yeah.
Yeah, and it has an educational component to it
Right.
too, so it's all good. But they have everything, including Jake the Pirate. So
Yeah.
take a look at what they've got. So we had a follow-up. There was a question that we had from somebody last week that we were very excited because they wrote in and said, how can a BCBA get more information about assessments and program design, because I want to be the best that I can be. We talked about it a little on the show, and they wrote back and said, hello, Shannon, what an honor it was to have you read my question on air and ask Dr. Doreen to answer it. I'm in the process of purchasing the items and
Acclimating myself.
acclimating myself, that's the word I want, to skills. I was overjoyed by your suggestion that I should work for CARD, and I would love to do so. They've sent me some information, and I'm gonna connect you with the person that needs to go to. So thank you for writing in, and we appreciate that.
That's
you
wonderful.
have continued
We'll
interest.
definitely get in touch.
There you go. Now, we also talked a little bit about the DSM-5 last week, and about people were writing in asking, is Asperger's still a part of the DSM-5? And somebody wrote into in the interim and said, can you tell me what the DSM-5 categories are? Is that a question?
So there are no
we can do?
categories with the DSM-5. That's why it's called ASD, because it's a broader. DSM-4 we used to have, like autistic disorder, pervasive developmental disorder, disintegrative disorder, Rett's disorder, and so on. But with DSM-5, it's all just one thing called ASD. And depending on the number of symptoms and the severity of the need, then you're on one end of the spectrum or the other end of the spectrum. And that allows, we are allowed to rate on severity. So in my mind, the severity helps. So if you have very severe needs in the social area and very severely debilitated with self-stimulatory behaviors, with ritualistic behaviors, then you would have a 3-3 severity. That means that you have a very high need for help, support in both the social area and in regards to your ritualistic behaviors. If you have a very mild need, then you'd be a 1-1 in those areas. So it kind of like helps me when and in fact at CARD we're doing this, we're rating all of our children based on the severity. A lot of professionals have not yet begun to use the DSM-5 appropriately or correctly, but that is essentially, to have an actual diagnosis, it says, autism spectrum disorder, needing significant support in the social area and support in the ritualistic area, that sort of thing. So it tells you the level, significant being 3 and just minimal being just support. So, and then you can do subtypes on their modifiers, such as, Asperger's type and so on. And you can also give descriptors of, behaviors in, also seeing mental retardation or also medical issues involved. But other than that, there are no subcategories anymore, and that's the main change with DSM-5.
It's kind of frustrating for I think all of us that are in the community at this point, that we're 2 years into this, and as you said, a lot of people aren't using it yet.
No.
So you might be working with a team of people, and we've had parents write in about this, that one person on the team is looking at these things and talking in terms of that. Everybody else is still on another page. The parents are someplace in between.
Oh, it's worse than that, Shannon. We have I don't even know if it's half, probably 2/3 of the insurance companies are still on DSM-4, and some of the insurance companies are requiring us to transfer all DSM-4 diagnosis into DSM-5, which shouldn't really be the case, because you're supposed to be grandfathered in, but they're requiring us, so we actually have to do a line-by-line transfer over, because you have a diagnosis of PDD, let's say, that you got 3 years ago. I don't know where you would fit in now.
Right.
So it's all these, it's causing a mess, but,
What else? What are other choices?
What are you gonna do? Yeah.
You gotta play with the cards you've been dealt. So that's where we're at. And I think it's important for all of us. I get frustrated, but I think it's important for me. It's important for all of us to acknowledge the frustration and look at it and go, yeah, that's frustrating.
Absolutely.
And then find the way through it.
Yeah, and I think I've done a detailed description about the diagnostic on one of our
Yes.
shows. So that kind of, if you want to watch that, that'll give you a lot more information about this.
Absolutely. There are 2 hours that are devoted just to
Great.
that with Dr. You can find those on our YouTube page with Dr. Granpeesheh. I'm going to move on to this next question. Hi, Shannon and Dr. Doreen. My son is nearly 6 and been having ABA programs since he was 2.5. He's doing great now. But what we are struggling with for quite a while now is fluency of his speech. It's really hard for him to make a sentence and keep up with his peers in discussion. Or even answering a question takes him quite a while. He also might start a sentence and then switch or keep repeating the last word. For example, the lady said. He is great when he is describing pictures and uses variety of verbs, but when it comes to interverbals, don't I love how much you guys embrace the jargon. When it comes to interverbals, he really struggles. He also prefers to use the same phrases for the same mans. For example, asking for a drink would always be, can I have a drink, please? We are trying to shape it, but he still uses the same phrases. Thank you very much, and thank you for having an amazing show. Lots of love from the UK. And P.S., they love our new studio. Thank you. Well, love back to you in UK, and how much do I love you, because you are clearly an on-it mom.
Yes,
right?
definitely. No question about it. Love it. You have a lot of really good questions. I'll try to hit all of them if I can. So the first issue is fluency. Fluency, you just have to practice and time everything. It is one of the types of ABA that we do. We will really not consider something mastered unless it's fluent. So a lot of his just basic lessons that he's good at already, like, you know, identifying actions or whatever, things that he's already mastered, make sure that he does them speed. So like he'll have a whole pile of pictures that he's describing, and he has to say, you know, the boy is running, the girl is doing, and just speed it up. And you can do that in a number of different ways. I mean, you can give him a stack and time it, and then tell him, okay, next time I'm going to put the timer on, but this time we have to do 12. Next time we're going to do 15, that sort of thing. You're speeding him up. Another way to do it is to use a metronome in the background, so that the metronome will just be something that he's comfortable with, and it kind of goes at his pace of language. It's almost like the beats of your speaking, like I am speaking right now, this is a beat, you know, and then I will speed it up a little bit, and then I'll have to speak a little bit faster. And so metronomes we use often to just speed up our kids. But, you know, the bigger issue here is that it's most likely processing speed that he's having a problem with. I mean, in ABA jargon, we call it fluency, but it is really processing speed. And processing speed, and it's clear he's smart, he's manipulating by trying to buy time. He's buying time when he says, the lady said, he's buying time because he's thinking when that's happening. So, yeah, you've identified the issue very well, which is processing speed. So you will increase his fluency. Now, when we talk about fluency, we're talking about being so fluent, like really thinking in that language and being so comfortable with the words that we're fast, that we don't have to think about everything we say. He clearly is still thinking about it, sort of like a person who's using a second language, right? So if I speak in French or German, I definitely have issues with fluency, and I have to think what I'm saying before I say it sometimes. And so that slows me down because I'm retrieving words. So processing speed tends to increase the more you are good at word retrieval. So anything that you can do, any kind of activity, like teaching actual vocabulary, just speeding up the use of words he already knows. You know, one of the things about normal language is that even when we read things, like when you're reading something, there are certain words that you just naturally learn to skip. You're reading them, but you don't care about their meaning. We automatically learn how to pay attention to words in what we read, the words that are important. all the, to, is, are, whatever, a, all that sort of stuff we don't really pay attention to. We pay attention to the key words. So that's something you can teach. A lot of reading programs actually do teach our kids what are the key words. In fact, one of the things you could do is have him read something and highlight the important words. This will increase his processing speed. And if you even look up, this is the program that I'm working on right now, Shannon, is like processing speed to me is a very, very important key feature of how our kids do. Because on the social level, if you look at it, like I might say something to you, and I've mentioned this to you many times before, like when I used to go to Germany all the time, and I realized that, wow, I became so much more part of the social environment when I could understand German really well. So I knew what's going on around me. And then, of course, the more you speak the language, you become even further part of the social environment. And when you don't understand, or you have to think about what was just said, or think about how to express yourself, you're not part of the social environment. So this is really just, he needs more practice on the language that he's learned. So, and that is something that you just have to continue to do with his ABA. In terms of intraverbals not being as good as things that are visual, essentially you're telling me that he's having a hard time retrieving information that's abstract or that's not visually present in front of him. So perhaps start with allowing him to make himself visual cues, or gradually working with him on fading the visual cues. You're on the right track. This is everything that you describe here is what ABA does. So you have to continue to work on all of these things through all of your ABA programs. Ultimately, I might teach a child blue as a very first concept. And then I might teach them to, the reason I teach them blue is perhaps because I want the child to know how to request a blue item, like give me the blue block. And then I might teach them to tact it and point out, oh, there's the blue car. And then I might teach them to describe a visual, so an intraverbal, but it's something that's present. So, she's wearing a blue dress, or what is mom wearing? A blue dress, or something that is not right in front of them and they have to think about it, like what color is the sky, and it's blue. So it's all the same concept, but it's used in numerous different ways through language, and the more fluent you get, the more practice you have, the better you are. I don't know how many hours he's getting. Obviously, this is something else that happens often, is that when our kids get to this point, and this might be the key to the answer to all of this, we think they've done so well that we cut their hours. So I guarantee you that if he gets about, at age 6, somewhere close to 30 hours or so of ABA, his fluency will shoot through the roof and you'll do really, really well. So I wonder how many hours he's getting now. Okay. That would be the most important thing.
So you could up that. Just as you were talking about the processing speed, I was remembering, if you haven't seen Temple Grandin's TED Talk, there's a part in it where she talks about, because she's visual and all of our kids aren't, but she says that there's a moment when she says, when you bring up a church, that most people have like a stereotypical church that pops into their head until they get more information.
Right.
They picture one thing. Well, hers is like Googling church and all the pictures that come up, that she has 750 pictures that her brain starts to go through until you give her more information, and then it's like, going through and redefining the search, and it shortens it, but it's taken her years to get to where that she can tell
summarize.
Her mind, summarize, don't go to 500 churches, come up with one typical church, and she languages that for herself. And I wonder sometimes if our kids are struggling with some of that too, that they're having to cycle through everything that they know to get to the thing that you're asking for. That's overwhelming.
I'm so glad you brought that up, and that's a fantastic way to put it. But I find, and many years ago we realized this, I find with our kids that everything comes... Okay, so first of all, everything comes at kind of the same intensity. So it's sort of like, how with us, like right now, of course, our language is the prepotent stimulus in this room. It's like we're talking, and that's what we're both focused on, as well as perhaps our body and facial expressions and so on. There's a lot else going on. The air conditioning just turned on, you know, the lights might flicker and so on, but we don't pay attention to any of that. With our kids, I think everything comes to them at the same level of intensity, so it's very, very difficult to ignore one thing and pay attention to the other. So there are many more stimuli coming in at the same time than there are for us. Our brain is able to filter those things out. And then when we learn content, we tend to learn it in a very organized manner. Our brains are set up in a way that we will learn. I always give the example, like you learn as a child, and this is what Temple talks about as well. You learn, for instance, a table, and when you're a child, you only really learn that, okay, what is it, you know, if you ask a child about a table, they'll say, oh, it's in my kitchen, or it's in our dining room, or yeah, I guess my desk is also a table as they get older, right? And, oh yeah, tables can come in all different, I mean, as a very small child, you only know about a table the way that it is at your house. You don't know that tables come in glass and wood and metal and decorative and different shapes and are used for different reasons and so on. But you add on to it, you know, that's working memory, and you just keep adding on and making it more and more and so on. But you maintain a summary of it. So it's like, okay, table, a place where you can sit at and do something. Okay, you can eat or whatever it is, but it's a summary. Many years ago, I realized that our kids don't summarize the info they get. This is why one of the programs I like is sort of the visualization, verbalization program, because it allows you to describe things and then answer key aspects of it. We have a program called Summarizing, because and this is, if you think about it, Shannon, the summarizing issue affects so many other things.
Absolutely.
Like it is the reason that our kids go or get distracted. It's the reason they can't retrieve information fast enough. That's the fluency issue, because there's a whole ton of descriptors and no exact, like, you know, how do I retrieve? If I ask a child, name something that is wood, table won't come up right away because it hasn't been classified there. It hasn't been summarized correctly. It hasn't been organized. Just think of your brain as kind of a library with thousands of things in there. And if they're just there, you're not going to find them. But if they're organized in some way, you will find them.
Yeah, imagine trying to search the internet without a search engine.
Exactly.
It'd be like, it would be so overwhelming.
Yeah, so that's what it is. It's the search engine.
And we can strengthen it. I mean, that's the good news.
That's the executive functions. That's what they are.
Wonderful. All right. Well, excuse me.
I went on and on about that because it was an exciting question.
No, because it is. I think that those things help us.
Right. And I just do want to address one last thing where the parent is asking for what do I do when the child is manding in the same exact way. One of the things you do is, I mean, first of all, I don't know if your child is a reader. It's very easy to change mands if you can write out a different way of manding. But you can also model it for the child verbally, and just go, I don't understand. So hold the item until the child gives you a different format of the mand.
Great. Fabulous. And then write in and let us know how all that goes. And again, love to you in the UK. My attention. Hello, my 10-year-old has autism, anxiety, and is blind. He recently started refusing to eat foods he has always liked, for example, fruits, veggies, even French fries. He also has started sucking on foods, which I have never seen before. He usually takes big bites, and I have to get him to slow down. But now he will take the tiniest sliver of a bite and take forever to eat. Where did all these behaviors come from, and what can I do? And thanks a lot. And bless your heart. You're dealing with a full plate.
Yes, you are. Most of the time, we change our food habits due to food aversion. So it is very possible that he ate something that caused him disturbance of some type, or caused him either pain or tasted wrong, or he had an illness shortly after, and in his mind correlated it to what he ate. Food aversion is one of the hardest forms of conditioning to break. There have been many studies on this. When something is paired with a food aversive, it almost never extinguishes. I'm not saying it won't in this case, but it is a very difficult thing. So my guess is he ate something at some point that either didn't taste well or didn't do well with him. So you're going to have to reverse this. It makes perfect sense because he is blind, that he is being cautious. He can't really see what you are giving him, and he's being very cautious in terms of eating it very slowly and in tiny amounts so that it doesn't cause the same aversion that it did the last time, or he so thinks. So and he's 10 years old. I mean, the only thing you can do is try to find, I think at this point, the one food or two foods that he does still consume readily or happily, and start there. Allow him to kind of gain his confidence back in terms of eating, and then gradually bring in those other foods that have become aversive for him. It's a pretty difficult thing, but essentially this is pre-MAC now. You're using a higher probability behavior to reinforce lower probability behaviors. So if there's other stuff that he is eating readily and he's not too cautious about, great, allow him to do those first, and then use them to, kind of bring in other stuff and make those the reinforcer. I have a feeling that if something smells good, he might eat it more freely. If it's something that has a smell that he's familiar with. Because for a child who's blind, he's going to depend on some other sense to give him a sense of familiarity of what it is.
Absolutely.
And of course, allow him to and I'm sure he does already, to, feel the food before he eats it.
Yeah, I can't imagine.
Yeah, it's very difficult.
How,
very, very difficult.
Especially if you have the anxiety and are not able to see. That
right.
It makes sense that he would suck on something to see what the edges are on it and to see what it tastes like before.
Yes, exactly. I wouldn't, and don't be too worried about this. He will gradually find his way back. He will definitely figure out that, although it might take a while, but he will find out that these things are not aversive or making him feel bad.
Okay, wonderful. Somebody wrote in and said, "Good morning, Shannon and Dr. Doreen. I love your show. We love you. My adult son is a big fan of scissors. He has kid scissors, but can do a lot of damage with them. Cut up things that don't belong to him. I've made a box of things that he can cut, but will still find things in the house. He will still find things in the house to cut up. I don't want to take the scissors away, but I'd love to hear your advice. Thank you."
Yeah, I think you have to, perhaps at this point, you will need to make sure that he does not have access to scissors except for when he is monitored and using it appropriately. So at this point, you will have to take the scissors away and give them to him only when you're able to watch him and he has the box of things that he's able to cut. And you'll have to do that for a while because you kind of need to break the habit of using the scissors inappropriately. And then, of course, if he does happen to use the scissors inappropriately, he does need to be reprimanded, just like any other child. We don't learn what's not okay unless someone tells us in a way that is, we don't forget that, hey, this is not okay. And for our kids, this is one of those things that is part of the safety issues. I mean, we have some lessons on teaching safety as a whole, but unfortunately with this, he's actually, the danger, there's two issues here. One is he's destroying other people's property, and the second one is that he could actually bring harm with scissors. Now, both of those have to have some sort of, punishment or some sort of retribution if he does them. So if he is destroying other people's property, then one way to do this is that you would take away something that he has and give it to the person whose property he has destroyed. He will hate that, he will tantrum, he will be very upset, but you have to kind of put something in place, and again, I don't know the scenario, but put something in place that is not okay with him, something that he really doesn't enjoy and that he finds to be aversive. If it's a safety issue, then you really need to watch over it and make sure that he doesn't have access unless you're there, and that he's only using it with the box of items that are allowed.
Okay. We had somebody write, the UK mom wrote back in, and she said, "Dear Shannon and Dr. Doreen, thank you for answering my question. You are absolutely right regarding the hours. As he is in school, we are not able to do even 20 hours of ABA
Yeah.
in a week, but now he is on holidays and we are upping the hours, and I will definitely focus on fluency. If you get a chance, could you please provide more information on the processing program you are working on now and when it's going to be available? And thanks a lot, the UK mom.
Yeah, I would actually recommend that you go in our executive functioning curriculum on skills. Skillsforautism.com, and you go in the EF curriculum, executive functioning, and there's a whole section on fluency and attention. Just look at all of those, because those will be very interesting to you, the EF section of skills. And yeah, in one of the notes I made here because of your lovely question is to touch base with our assessment, with our psychologists, because we are developing this sort of more cognitive program than behavioral.
Okay. We had another question that came in this morning. Hello, Shannon and Dr. Doreen. I have to say the program, every question asked by the viewers applies to my son, almost like the program was made for me. Thank you. Love you guys. We love you back. Question about how an ABA therapist can be assigned when there are two children on the spectrum at the home. One is a school-age child with a lot of behaviors and on medication now, and the other a toddler with speech delay. Both very active children, both need constant redirection. My oldest was on ABA before moving to a new state, and it was difficult for me to handle, alone to handle. I wonder, when adding my youngest child who does have aggressive behaviors, how can this be possible? Does it mean to have
we would have to have the same therapist for both?
And I don't want to feel that I'm working more with one child than the other, but I feel that there's not enough of me to address them both, and thank you so much.
Yeah, and this is, I agree with you. This is one of the reasons that I'm a very strong advocate for parents in terms of, when funding agencies and educational agencies and so on expect parents to be the ones teaching everything. It's impossible. I mean, with typical children, you need help from others, obviously. You have teachers and nannies and so on and so forth. And if you have two children who are on the spectrum or have various difficulties, it is impossible. I know that what we do at CARD here is that if you have two children on the spectrum, you have two teams. The therapists do not overlap. You have one team focusing on one child, another team focusing on another child, and sometimes they're there at the same time. We just treat it like two separate children. You, of course, are a parent, and I don't know if you have ABA going on and how you're working with the children, but please try to get behavior therapists in the house. You really desperately need the help. And also, if it's only you and another child, then split up and have the therapist work with one child and you work with the other child. But you separate the two issues, and it sounds like the kids are quite different, both in age and capability, so you do need to separate them completely. You cannot, at this point, work with the two of them together.
But eventually,
hopefully, you will easily be able to go with one person monitoring the situation, but you're just at the point where one child is aggressive, then you kind of need to separate them.
Okay, we just had a question that came in, and somebody said, please weigh in if there is time. I just got a summer schedule request, and every season there are more and more rules attached. Now we're told that clinics can only be before 3 p.m. Due to traveling to and from the office and such, my son cannot miss nearly a full day of school every second week. And they said, who's making the rules? And I know that this is something, sometimes
Thank you
just
for bringing that.
Yes,
I appreciate
sometimes
that.
you just get a rule and you don't understand where it's coming from or what's happening. So I'm glad that we had time.
Thank you so much for that.
Yeah.
So I appreciate that somebody brought this up. I really do. And I would like to actually know which office you're in, because that is not correct that clinics can only be before 3. What I'm guessing is that most slots after 3 are booked. So we are adjusting to the rules that are set for us. So unfortunately, it makes it a little bit harder for our parents. I completely understand, believe me. But I kind of want to give this perspective. I'm so glad that a parent brought this up, and I really appreciate your patience with this. We also are very frustrated, but here's how it goes. So we have, it starts with the insurance and various other agencies mandate that we have to use all of the hours. Obviously, we want to use all of the hours. We fought for these hours for our families. So if I request 20 hours a week for a child, I really want to provide those 20 hours to the child. Very, very often, I'm not able to. The reasons are the following. The children are in school in the mornings, and so the parents only make available to us exactly 20 hours. Now, I don't have therapists that are exactly available during the 20 hours or so that a parent offers us. In fact, all of the therapists who work at CARD are solid packed in the afternoons, and because a lot of the kids are in school in the mornings. Yeah. So we have all these therapists who don't want to stay because they're looking for a full-time job and they're looking for morning hours, and none of our families have morning hours available. We have so many therapists who work weekends, but obviously therapists would like to have a normal life and work during work week. Yeah. But so one of the things that is very helpful to us is to have clinics which only occur twice a month or once a month in some cases during the mornings. That means, yes, you will occasionally have to pull your child out of school to bring the child to the clinic to allow the staff to meet with you for 2 hours and review the child's program. Now I ask you, I know parents are not used to this, but I ask you, if your child had braces, would you pull the child out once a month or twice a month to go see the orthodontist? Of course we do that. My kids do, and I do that. If your child had some special other, like had to get vaccinations or had to get whatever, physical, or was physically ill, often we pull our kids out of school in the morning in order to do something that's very important. For parents, you have to recognize that ABA is probably the most important thing you're doing for your child right now. So it is important that you help us in providing all of those hours. Another thing that really is very difficult for us is that parents will say, oh, I really want my child in a social activity, so we have basketball practice, so I can't do therapy from 2 to 4 on this day. Nothing should take priority over your ABA therapy. Your ABA therapy is the most important thing. So, this is just one of those situations that where we're not just imposing rules on you to be unfair. If we don't use all of the hours that have been given to us, that have been funded for us, your next cycle, which is 6 months or a year from now, when your insurance company will renew your funding, they will cut those hours. So the way that insurance companies look at it, they say, you're not using it, that means you don't need it. And so therefore, we're not going to fund it, we're going to give you fewer hours. So we have to use the hours we've requested, not only because of that, obviously because it's the best outcome for your child. So we really, really want to use those hours, and we need your help. We would love to be able to give you therapists in the afternoons, but as I said, that's when the therapists are doing therapy. Yeah. And if we pull them in for a clinic, then they're missing, your child or some other child is missing tons of hours.
It might be 5 therapists at the same time missing all that opportunity.
Exactly. For your child's clinic, then 5 other children are missing sessions. Yeah. Now, what I need parents to really understand is that all we're really asking for is a 4-hour, maybe 3-hour commitment per month of pulling the child out, bringing them to the location so that we can do clinics. The other issue is coming to the centers. Truthfully, I know that it requires a little bit of drive time, but the truth is that center-based services allow us, if you can bring your child to the center, that allows us to have back-to-back sessions. That means the therapist is not spending hundreds of hours on the road. These are valuable and trained professionals who really need to be spending their time working with the kids.
Instead of driving.
And they're driving all over the place. And I have to be very honest, there are 2 reasons that therapists leave. One is their schedule, which means they don't have morning hours or they have huge gaps in their schedules. Okay. And the second one is the amount of driving and the toll that it puts on their cars and their lives and so on. So we're really just asking parents to be helpful with this. You know, I remember, Shannon, when I first opened my first office, and all the families that I had, maybe 10 or 15 families at that point, found it very difficult to actually come to the office once a month or once every week or second week. A lot of families have been doing this for years and years. Others are just not accustomed to it. I understand it's further for some parents. And, you know, that's why we're opening more locations to be able to help all the parents. But we really ask for your help with this, because I know it's a little bit of a burden on you, and we don't want to put more of a burden on our families, but we're trying to do everything we can to not lose our therapists and to efficiently use their time. That's really the answer.
And I go, as a parent, and we're way out of time, we have to get you out of here, but I will say to you, as a parent, having been through this, I would say to you, this is another one of those things, like we said at the beginning of the show, it's frustrating because you're having to choose between my child goes to clinic or my child goes to school, and you don't want to have it be that one has to go one day a week. I get totally with you on the frustration of it. But one thing that really helps is when you set your priorities and you say, here's what's most important to me, here's what's most important. We all know for our kids with autism that it's really important for them to be in school, but they couldn't be in school and be successful in school without the ABA. So I would encourage you to put the ABA well above school for these years. And if you do, you'll find that later on, then school is the priority when it needs to be. It's a hard choice, and it hurts. But you got to set your priorities with that field that we've been set, and there are limitations because of the field.
And I want to thank our existing families who are center-based. I mean, I have a quarter of our hours, 25% of our hours currently are being provided at CARD centers. And I really want to thank our families who are willing to bring their children in and allow us to provide the therapy there. Those kids are doing fantastically well.
Yes, if you are a CARD family that hasn't done the center-based, talk to one of the families that has, to see the benefits that they're getting from it. It has benefits for the kid, and it also has benefits for you as parents. It really does. We're so